Hey everybody, I am here with Dr. Kevin Brenner. You can find him at kevinbrennermd.com. So we're here to talk about cosmetic surgery and some of the treatments and procedures available today. So Dr. Brenner, thank you very much for joining us today. I appreciate it.
Excellent. Thanks for having me.
Absolutely. Wanted to start off just by asking how long you've been working as a plastic surgeon.
So I have been practicing as a plastic surgeon since I finished my training in 2006. I first had done a general surgery residency, was a general surgeon, then did a second residency in plastic surgery, which completed in 2006. And I've been doing it so about 16 years now.
Okay, yeah, awesome. That's fantastic. Was there anything in particular that drew you towards that, made you want to help patients with those cosmetic goals?
I mean, yeah, I always was very technically inclined growing up, and when I was in med school, knew I wanted to do surgery in some capacity. Was introduced to plastic surgery fairly early in my clinical training, and just was drawn to it. Technically, it's very challenging, but it's also very creative in terms of a lot of the stuff we do, in particular reconstructive surgery, but even cosmetic surgery. There is somewhat of an artistic edge to it.
Yeah, absolutely. And I think having the results right then can be, really gratifying in that sense too.
Gratifying for me, but also for the patients. I mean,
Yeah.
for some of the stuff we do, it's a bit of a process,
Mhm.
but some of it, it's almost an immediate change.
Mhm. Yeah, absolutely. What are some of the main procedures that you focus on there at your practice?
So since going into practice, I've always had sort of very diverse practice in terms of procedures that I do,
Mhm.
but the overwhelming majority of what I currently do is breast surgery, in particular breast reductions, lifts, and now have a very large percentage of my practice of breast explants, where we remove implants, remove the capsule that's surrounding it,
Mhm.
and then rebuild or reconstruct the breast to make it look like a nice looking breast without an implant. And so, I've been doing basically revision, implant, redo, implant complications, managing those for years and years,
Mhm.
and doing kind of basically what I call aesthetic reconstruction of the breast
Mhm.
for a long time. And now I'm using that and applying it to explant surgery for patients with breast implant illness primarily, but there are other reasons that people decide to permanently remove their implants,
Yeah.
and ultimately the procedures are all very similar in terms of how we recreate that breast mount.
Okay. Do you find that most patients that have that done are patients that, have never really been happy with the result that they got, or is it just over time they've decided, and like you said, they're ones that are having complications from it?
It really runs the spectrum in terms of the patients that I've seen. I would say over the last 4 or 5 years, I've just seen almost a logarithmic increase in the number of patients who feel like their implants are making them ill,
Mhm.
and the it for a lot of them, they look great. It's not a matter of them not
Mhm.
looking how they look. I mean, they got a lot of women get breast implants because either they just have always been self-conscious about it,
Mhm.
had changes after having kids, post-pregnancy deflation of their breasts, and want to just sort of restore what they had before
Yeah.
having kids. Um, and so, I think for a lot of people, I mean, we see all these examples of like sort of extreme plastic surgery because it gets a lot of media attention, but that's not really the bulk of it.
Mhm.
Most of the patients that go in for breast augmentation are very reasonable kind of
Mhm.
citizens of the world, and for a lot of them, they've had their implants in for years. I mean, 10, 15, 20 years with no problems, and then will start developing different things. Sometimes it's with the original implants. Sometimes they have some reason to have a secondary surgery, like a rupture or a capsular contracture that develops
Mhm.
later on the years, and then following that they develop symptoms.
Mhm.
Um, I really see it from, I really see the full spectrum. I mean, I have patients who it's very questionable whether or not their symptoms are serious or related. And then I have patients who are so sick they can barely get out of bed, they can't function, they can't go to work, they have a hard time taking care of their kids.
Yeah.
And the remarkable thing is that when we remove the implants, remove the capsules, patients start feeling better. And it's not, I don't guarantee it to anyone because I can't. I don't have a crystal ball, but I've been tracking this because my volume is so high. My practice has been tracking these patients in terms of just checking off what symptoms they have, how severe they are for about 1.5 to 2 years. And at least from what we can tell in our data, about 95+% of patients have some degree of improvement. Some people only get a little bit of improvement. Some people get near complete resolution of their symptoms. And it's understandably controversial because it doesn't necessarily make a lot of intuitive sense to people. But what I think is that some people just have this immunologic response to having a foreign body.
Yeah.
And sometimes it's very insidious in terms of the onset of it. Number one. And number two is most of the symptoms that people describe are can and do happen with other disease processes. There's nothing that's, my favorite medical word is pathognomonic, right? That means that it's specific to one disease process. There's nothing that's pathognomonic about breast implant illness because patients come in with, let's say, joint pain. Joint pain can happen with arthritis. It can happen with sports injuries. It can happen with lots of other things. People come in with hair loss. There are hormonal imbalances that cause hair loss. People will come in with brain fog. There are multiple things that cause brain fog. People get brain fog after having COVID or after having the COVID vaccine. So even without breast implants, people come in with chest pain. Well, we all know that there's lots of other very serious things that can cause chest pain. So, my job is almost like the detective to try to sort out. I mean, I'm trained as a plastic surgeon. I'm not a rheumatologist. I'm not a cardiologist. I'm not a gastroenterologist. I don't try to be. I leave that to the experts. But I see enough of the patterns that I can kind of sort through it and explain to the patients, make sure that they get worked up to make sure that they don't have more serious problems. And the truth is we, even right now, as you and I are talking, we don't know exactly what the cause is, and we're trying to figure it out.
Yeah, definitely. And so it doesn't sound like it's like a particular type of implant or a way of doing it that's causing it. It's more based on the patient themselves and kind of just how they react to it.
It's the best that we can tell. And this is not just me. I mean, there are other surgeons, other board certified plastic surgeons, reputable surgeons around the country who I've talked with, who I talk with regularly, actually, who are seeing kind of the same things. And it's just an interesting thing. It's not specific to any one type of implants. I see it with silicone implants. I see it with saline implants. I see it with smooth and textured. I've seen it with just about every implant that's available in the U.S. market. So back in, there's a lot of comparisons that were made to like the 1980s and early 90s when silicone implants were in the media a lot. People were describing what's like a silicone reaction and diseases that are potentially caused by silicone. And I'm not saying that didn't happen, because it did. And this, depending on what studies you read, will tell you what you believe. But it's not just with silicone, and it's not just with ruptured implants. Most of the time, the implants grossly look perfectly fine. They're intact. There's no fluid. There's no mass. I mean, 3 years ago, one specific type of textured implant was removed from the market because of a link to ALCL, which is a lymphoma that was developing around the implants. But this isn't breast implant illness isn't it's not a cancer. There's nothing tangible to it, which makes it very controversial amongst all physicians and patients, but in particularly among plastic surgeons. I mean, most plastic surgeons I talk to don't even think it's a real entity, which makes it a little bit of an uphill battle.
Yeah, I can imagine. And so do you find that that's the same issue with doing like the fat grafting and fat transfers, or just with the implants themselves and the foreign ones?
I mean, the fat grafting, fat transfer, breast lifts, those are all sort of ancillary procedures. Really, the nuts and bolts of it is getting the implants and the surrounding capsule out and doing it safely for these patients. You know, I talk a lot about restoring the breast, and that can be breast lift, that can be breast reduction, that can be fat transfer, that can be both. Because, you know, patients go into this surgery, I mean breast augmentation, with a specific goal. They want to look and feel feminine, and they want to feel nice and confident in their clothes.
Sure.
So, you know, the biggest downside is sometimes you're taking a breast that looks pretty good with an implant and making it look, and at least initially, not so good. And so my job is to say, okay, what can we do to make your breast look as good as possible?
Yeah.
People don't realize, and this is, I don't know if it's the patient's fault or the doctor's fault. It's probably the doctor's fault, just in terms of maybe not knowing to explain it or explaining it thoroughly. But just putting in an implant has physical changes on a person's body. Forget about breast implant side, just everyone with an implant. I mean, it's a space occupying foreign body that's pushing on your chest wall. It's stretching out your skin. It's weighing down your skin. It's, you know, it can thin out the breast tissue. And so there's a lot of changes that happen to the breast, separate and distinct from breast implant illness, that change the way that we're able to do revision surgery on that breast, right? In terms of what the blood supply is going to be. So, you know, I always tell patients I will do what I can do with what you give me. And by that, I mean, if a patient has a lot of breast tissue when they have their implant out, when I take it out, I know that I'm going to make their breast look great. I mean, I have patients who come in who, quite frankly, you know, their original surgeon missed the boat, and their implants are way too big, or they just don't look right, or they should have had a lift, either in addition to the implant or in lieu of the implant. I hear that a lot.
Yeah.
People get talked out of a lift because they don't, or they come to the doctor and say, you know, I don't want the scars. What can you do? And they'll put in. They think, you know, the surgeon says, well, if a small implant would look good with a lift, maybe if we put a bigger implant in, you won't need a lift. And perhaps initially that might look great, but you know, years down the road, it never looks great.
Yeah.
And then there's also a group of women who, you know, really had no problem with their implants whatsoever, don't have any symptoms, but maybe have had their implants in for 15, 20 years, or just tired of having them, tired of the weight. Maybe they've had a couple pregnancies or gone through menopause, and their breast tissue gets bigger, believe it or not, and now suddenly they're bigger than they ever wanted to be with the implants in, and so they just come in, they just want to be sort of a more normal proportional size. And so that's actually a significant portion of our patient population as well.
Okay. Yeah, that makes sense. And so is there, I mean, like you said, it's kind of hard to touch on specifically like what those symptoms are that they might be experiencing, but are there any common ones that you could maybe share that, you know, if a patient's dealing with, they might consider?
For breast implant illness? Yeah, I mean, you hit the nail on the head. There's probably 40 plus symptoms that have been associated with it. I would say the most common ones, and if you forget these, go to my website, go to my Instagram, because I have a ton of information. I actually have a holistic breast team, kind of paramedical specialists that to help with the various issues that patients have.
Yeah, that's great.
I'm a surgeon. I'm good at surgery. That's what I do. I'm not good at these other things. I don't want to be. It's not my job. These guys are the experts. That's why we brought them all together into our team. But in terms of the symptoms, yeah, I would say one of the most common is brain fog, just can't quite string together thoughts, maybe grasping for words. Joint pain is particularly common. A little bit of hair thinning or hair loss. Some people develop very unusual rashes. Chest pain is not terribly uncommon. More commonly is like breast pain around the implant.
Yeah.
I'm not talking about infectious pain. I'm talking about just sort of like neuropathic pain around the breast and implant. And those are pretty common. The other thing that we see fairly commonly, and we see this, sometimes we see it pre-op, but a lot of times we see it intraoperatively when the patient's asleep, is that these patients are chronically dehydrated. And I don't know why exactly, but I just know, and it's not 100% of the time, but the overwhelming majority of these BII patients, when we bring them to the operating room, are chronically dehydrated. It takes a lot more fluid to get their kidneys going than the average plastic surgery patient. And what we've sort of discovered is that a lot of these patients have dysregulation of what's called the autonomic nervous system. The autonomic nervous system is our involuntary nervous system. So, you think about, we have motor nerves that make everything move, you have sensory nerves to feel everything, and then you have the autonomic nervous system, which is how your brain regulates your heart, your lungs, your kidneys, your intestines, like all of the blood vessels, the tone of the blood vessels. It's what makes your heart go faster and slow down. And so there's something to this process that in some patients causes imbalance. That sympathetic, which is like the fight or flight response, and the parasympathetic, which is like the slow down and go to sleep response. And so we see patients with orthostatic hypotension where you go to sit up, and whereas you or I may go from a laying to a sitting position or a sitting to standing position, and our blood vessels can compensate relatively quickly, theirs cannot, and so the blood pools and they end up passing out. And I've had some patients with who even develop seizures as a result of that. So those are probably the more common thing, but I've seen, I've had patients who, believe it or not, didn't even think that who had rheumatoid arthritis, didn't think it was related. We took out their implants. They didn't even think they had breast implant illness, but lo and behold, 6 months after removing everything, their rheumatologists are measuring their markers, and their markers have returned to normal. By markers, I mean like the autoantibodies that we see for arthritis, RA factor. I've seen patients with Hashimoto's thyroiditis. That's an autoimmune phenomenon of the thyroid gland, and that either developed after they had their implants, or perhaps they had it before and it just got worse after they had their implants. And then we take it out and their numbers come down. I've had patients with pancreatitis, inflammation of the pancreas gland, that one of the best pancreas surgeons, the pancreas doctors at Cedars-Sinai, which is our big hospital here, weren't able to figure out what the cause of it was. It wasn't from, we think of pancreatitis, usually it's from people have gallstones, or they're alcoholics, drink a lot, and that can cause inflammation of the pancreas. This patient had none of that, wasn't on any medications that you think might cause it. 3 months after surgery, she was completely free of pain, and her pancreas enzymes were totally returned to normal. So we, that's an outlier, and it's but it happened, and that particular patient that I'm thinking of, we actually have her lab work to show that before surgery this was what it was, and after surgery, and you don't see that very often where you can document with lab work, because no two patients are exactly the same.
Yeah, definitely. Yeah, well, that's great, info to have, and I'm sure the patients that might be experiencing those would really, appreciate to know that could be a potential cause of those issues. For a patient that's, maybe listening to that and is thinking that might be something that they're dealing with, what would you recommend as their kind of first step in the process? And, what would be the best way for them to come see you guys?
Well, the first thing is, and I tell this to everyone even before they come in and see us, and my staff tell them, like, if you're having like serious symptoms,
Mhm.
whatever it may be, right?
Yeah.
If it's serious enough to kind of interrupt your daily routine,
Yeah.
don't wait to come see me to figure out what it is. Go
Mhm.
to your doctor, whether it's your internal medicine doctor, your family practitioner doctor, even or your OB or whoever it is that coordinates your care.
Yeah.
Go to them, let them know what's going on, and start whatever evaluation. Don't wait, because there are, and I don't minimize this at all. There are serious things that happen, even to young people. There are serious things that can happen,
Mhm.
and so we don't want you don't want to. It's very easy to chalk symptoms up to breast implants, and
Right.
I don't ever like to do that, because it's really a diagnosis of exclusion.
Mhm.
So that's the first thing. The second thing that I tell patients is, trust your instinct, because, and this is super important. Most patients that I talk to who are going through this,
Mhm.
uh, they may look and grossly may look fine,
Mhm.
and oftentimes they'll go to their doctor, and their doctor says, "You're fine, don't worry, there's nothing wrong."
Mhm.
Or they'll go to their plastic surgeon, "Your implants are fine, there's nothing wrong with them, go live your life."
Right.
I hear time and time again that, and if they push on it, "You're crazy,
Mhm.
there's nothing wrong, it's in your head,
Yeah.
there's nothing physically wrong with you. Don't take out your implants, because
Yeah.
this is all manufactured in your brain."
Yeah.
And while that may happen sporadically, that's not the case. I mean, I have seen. I mean, I see patients full spectrum.
Mhm.
I'm sort of in a unique environment in Beverly Hills, and I take care of patients, who are kind of everyday workers, mailmen, grocery store clerks, all the way, executives, bank executives, people who CEOs of large corporations,
Yeah.
A-list celebrities, okay, who these patients have no secondary gain. They have no reason to manufacture this.
Right.
And so, like, when you see that, and that their stories are so similar and overlap so much, you can, at least for me, I can't help but question that there's something to it.
Yeah.
So, so I tell people, trust your intuition. If you really, I mean, there's no one that knows your body more better than you do. So
Yeah.
if you really feel like something's wrong,
Mhm.
you need to look into it and figure it out. Don't
Yeah.
just let it go just because one person says to you there's nothing wrong with
Right.
you. Doctors, for the most part, are great, but we're not infallible. We're human beings, and people make mistakes.
Mhm.
Number one. Number two is medicine changes. And if you had asked me 8 years ago, we wouldn't even be having this conversation,
Right.
because it wasn't really on the radar,
Mhm.
but it certainly is now.
Yeah, definitely. Yeah, I'm sure patients really appreciate you taking time to look at them as, an individual patient as well, and not just assuming like if they don't fit into a particular category of what's kind of expected from that patient, then, it must not really be happening. So, I'm sure they
Yeah,
really appreciate for that from you.
totally.
Mm, Definitely. Cool. Well, yeah, those are pretty much the questions I had for you. So I really appreciate you taking the time to share the education and everything.
Got it. Well, I hope that maybe your viewers will learn something from this. So
Definitely. Yeah, I believe so.
that's why we do this.
Yeah, absolutely.
All
Perfect. All
right.
right. Well, have a great rest of your day, Dr. Brenner. I appreciate it.
You too. Thanks. Take care.
Appreciate it.